Hello YouTube, I'm Dr. Fox. Today, I'm going to answer several questions related to home pregnancy tests. When you are pregnant, your body produces a hormone known as human chorionic gonadotropin or HCG. This hormone can be detected in the blood of a pregnant woman from as early as 6 to 8 days after conception, and in her urine from until a day or two before you expect your period. Pregnancy tests are usually urine tests that verify the presence of the HCG hormone in a woman's blood. However, as urine tests will not be effective until 1 to 2 days before your period is due to commence, it is possible that the test may generate a false negative result. It may say you are not pregnant when you actually are. For this reason, many pregnancy test suppliers recommend that women who have had a negative result should repeat the test a week or two later if their period had still not commenced. Okay, first question. How accurate are home pregnancy tests? According to the manufacturers of home pregnancy tests, pregnancy urine tests are up to 99% accurate if the test has not expired and the user follows all the instructions precisely. The accuracy of the test will vary according to the following factors. First, how you use them. It is crucial that the expiry date of the test has not passed and that the user follows all the instructions properly. The test results will be displayed on the test window within 10 minutes. Therefore, you should wait for a certain period before you check the result. Second, when you use them. The amount of HCG that is present within the female's urine increases as the pregnancy advances. If you perform the test before your period is due, it is likely there will not be sufficient hormone in your urine to generate a positive result. A majority of pregnancy tests are only able to detect pregnancy after a missed period. There is also evidence to suggest that taking the test first thing in the morning can increase the accuracy of a home pregnancy test. Third, who use them? Women have different ovulation and menstrual cycles. In addition, a fertilized egg may implant at different times. The human body starts to generate HCG after implantation has occurred. For up to 10% of women, implantation will not take place until after the first day the period has been missed. This means that home pregnancy tests will not always generate accurate results as soon as the first day after a missed period. Some women may need to wait for a few more days. Last, the quality of the test. Some home pregnancy tests are more sensitive than others and therefore can detect a positive pregnancy at an earlier time. Seek advice from your pharmacist on which tests may generate the most reliable results for you. Next question. The home pregnancy test result is positive. What should you do now? If the test indicates that you are pregnant, it's highly likely that you are. Your next step should be to call your medical provider to schedule an appointment to verify your pregnancy and discuss the next steps. As home pregnancy tests are renowned for being reliable, your doctor may not need to perform a further test to confirm your pregnancy. However, if the doctor chooses to do so, a blood sample will be taken and tested for the pregnancy hormone. It is important that you see your doctor as soon as you receive a positive pregnancy test result because you will need to immediately commence prenatal care to ensure you and your baby are healthy throughout the pregnancy. Okay, then how about this question? My pregnancy test says I'm not pregnant. Could I still be pregnant? My answer is yes. It is possible you could still be pregnant. It's possible to be pregnant and to have a pregnancy test show that you are not pregnant. I mean, negative results are less reliable. Some women have negative test results only to progress to find out they are pregnant at a later date. The accuracy of home pregnancy test results varied from woman to woman because First, women ovulate at different times in her menstrual cycle. Therefore, even though you may have missed your period, your body may be yet to produce sufficient pregnancy hormone to generate a positive test result. Second, the fertilized egg can implant in the woman's uterus at different times. As a result, negative test results are not as reliable as positive results. Third, sometimes women get false negative results when they test too early in the pregnancy. False negative means the test says you are not pregnant when you are. Last, problems with the pregnancy can affect the amount of HCG in the urine. Okay, the HCG levels of pregnant women double every 48 hours. As such, if you get a negative home pregnancy test result, wait a few more days and then repeat the test. If you receive negative results from multiple tests, yet your period has not started, you can book an appointment with your doctor. Okay, next question. Can medications affect the reliability of home pregnancy test results? A number of factors can impact the extent to which home pregnancy tests are accurate. One such factor is medication. Women who take medication that contains HCG as an active ingredient may receive a false positive test result. A false positive is when a test says you are pregnant when you are not. Many infertility medications contain HCG. Therefore, if you're taking medication to help you get pregnant, you may want to see your doctor for a pregnancy test. If you are taking medication and are unsure as to whether it may impact the reliability of a home pregnancy test, read the accompanying patient information. Alternatively, seek advice from a pharmacist. The majority of medications, including antibiotics and birth control, do not have an influence on the accuracy of home pregnancy tests. Likewise, the use of alcohol and illegal drugs will also not have an impact on the results. If you have a positive pregnancy test result, but finds that a later test is negative or your period starts, there is a possibility you have had an early miscarriage. In such a situation, you should seek advice from your doctor. Okay, next question. What if I am unsure whether the home pregnancy test is positive or negative? It can sometimes be difficult to tell whether a home pregnancy test is negative or positive because the line may be very faint or you may be worried about that you have peed too much or too little on the stick. Regardless of how faint the line is, if it appears, it's likely that the test result is positive. The faintness of the line may simply mean that your HCG levels are still somewhat low. The majority of home pregnancy tests have a line that tells you if the test has been performed correctly. If the control line does not appear, it means the test was unsuccessful and you will need to repeat it. Okay, next question. How do you use a home pregnancy test? All home pregnancy tests come with detailed instructions. While the exact process of performing the test may differ from brand to brand, the instructions typically involve immersing the stick in urine. You can do this by holding it in the stream of your pee, peeing into a cup, and then dipping the stick into the cup, or peeing into a cup and using a dropper to put the urine on the stick. The amount of time you will need to wait before reading the result will vary from brand to brand, but the typical time is around 2 minutes. Again, the way the results are reported will also vary from brand to brand. Some brands may display a plus symbol, others a line, and others still the words pregnant or not pregnant. Regardless of how faint the line or symbol is, the result is positive. The majority of home pregnancy tests also include a control indicator in the result window. This lets you know whether the test has been successful or not. If the line or symbol fails to appear, you will need to repeat the test with a new home pregnancy test. The majority of home pregnancy tests come with details of a home number on the package that you can call if you need any advice on how to use the test or you have any questions about your result. Okay, next question. My periods are irregular, so I don't know when the next one will start. When should I perform the home pregnancy test? The majority of pregnancy tests are the most accurate after a period has been missed. However, if you have irregular periods, it may be difficult for you to know when to take the test. A period is classified as irregular in the following situations. First, there is less than 21 days or more than 35 days before each period. The number of days in the menstrual cycle changes from month to month. For example, your cycle may last 21 days one month and 35 the next. If your periods are irregular, try to calculate the date of the 36th day after the commencement of your last menstrual cycle, or 4 weeks since the time you had sex. By this point in time, if you are pregnant, there should be sufficient HCG in your blood to generate a positive result. If you do a test, the result is negative, but your period still doesn't start, wait a few more days and repeat the test. Alternatively, make an appointment for a blood test with your healthcare provider. Thank you for watching. See you soon.